Auzubillahiminash-shaytanir-rajeem. Bismillahir-rahmanir-rahim. Assalamualaikum. Ji ayanu. Pakhair agale. Ni hao. Chunashumme. Washmale. Ohio Gonzaimas. Guten Morgen. Hola. Bonjour. Privyet. Kaifa hal? Hale shuma chatore. Ahlan wasalan. Marhaba. Buna. Mucho. Gracias. Swabi. Abballi kare aaya. Hosh gal din. Anayos aaya. Huyamora. And thank you very much, everybody, for tuning into PTV World. You're certainly watching World this morning alongside my very amazing, well-learned colleague who happens to be Miss Haja Sati. I happen to be Shahzad Hassan Khan, and we hope and pray that everybody out there is doing wonderfully well and that you're ready to kickstart your day with us. First things first, hello Hajra, how are you doing today?
Assalamu alaikum. Thank you so much, Shahzad, for introducing me, and thank you so much for saying welcome in so many different languages.
Oh, thank you. Ohio Gonzaimas.
Yeah.
I forgot that.
Ohio Gonzaimas. So I don't think so you can say that in a one long breath. Can you?
I
because
can.
they're so really?
Yes, I can.
Wonderful.
I think so. Do you want me to give it a try?
I think
I think it's going to be boring for the viewers now because you know they're very used to of hearing it every single morning. So I think tomorrow I'm going to give it a go.
You can try that.
Yes, exactly.
So Shahzad, we've seen that Pakistan has a very rich cultural tradition, and puppetry was one of the forms that was popularized in Punjab, and that too by the gypsies, right? We call them Khana Badosh in Urdu, and they had their way of constructing that puppet dolls, although we have seen their appropriation in the popular culture in the form of the black magic, which is very creepy, but then puppetry had their own form of conveying messages, and Pakistan's history is mostly oral, it's not written, so a lot of things were said by the words, and obviously, you know, the oral cultural history has do not have a written value in that sense. But then they were popularized by the gypsies, and they used to travel around the world, and they used to take that art form around the world in the Europe, in Spain, in England, in France, and where not.
Yes.
Yeah. And it is said about the King Akbar, the Mughal king, that he was very strict. So people were very afraid to speak truth to his face. So in that time, that art form flourished because then people used to say truth via those puppetry shows.
True.
Because you're not saying that, puppets are actually saying that, right? And this is what Habermas defines the public sphere, where we can have the critical debates. And that was this affair where the puppetry flourished. And unfortunately, that art form is dying now because we are not supporting our artisans that much. But I think that there are recent efforts in this regard to revive that art form, to keep it on the floating track, because this is the part of the Pakistan, this is who we are.
Exactly, and that might be one case, but on the other hand, I think it's all about interest. It's not that puppetry is dying down over here in Pakistan. I think even we speak about PNCA, they always make sure to come up with such amazing more content as well. It's just that we might not be able to witness it. And I think it's sole responsibility of media houses like Pakistan Television to make sure that we highlight each and every aspect of our culture. But having said that, don't you think that there's so many things we need to talk about, you know, with our parents, and we cannot say that, and we can use puppets to kind of do that? And they might be like, bete, tu badmashi na kar, tu aisa kar ke khud baat kar de. So I think for everybody who's out there, Farooq Kaisa Saab has been that name, a household name. I've been his neighbor for a longer period of time myself. May his soul rest in peace. And just before he passed away, I was lucky enough to conduct a show, and that's what he spoke about. He's like that it's there, it's just that the people have very different interests now. So even in today's time, if you want to see a puppet show, rather we would watch it on YouTube, right? So I think what we need to do is that we need to bring in technological intervention to make sure that that art form is still visible to the audiences.
And you know, the sorry state of affairs is the Khana Badosh or the gypsies, they're actually selling their puppet dolls out there because there's so much poverty out there. And obviously, I think we need to do more than, I mean, just keeping it revived in the PNC or that, so that art form can remain intact, especially on the artisan, on the grassroots level.
Exactly, and not just that, you know, there's so many other fronts where we really need to do quite a lot, which is why, you know, this news update, which we are going to share with you, ladies and gentlemen, is very alarming. This day we are observing today, everybody needs to speak about it. Parents need to speak about it while counseling their children. So let's go, let's take a listen to what's happening today. Why is it a very important day today?
So today is obviously 1st of December, and it is being observed as a World AIDS Day to raise awareness about the AIDS pandemic caused by the spread of HIV infection and measures for its prevention and control. The theme Equalize is a call to action. It is a call to action for all of us to pursue the tried and the true methods required to redress disparities and aid in the eradication of the AIDS. So Shahzad, World AIDS Day was the first ever global health day held for the first time in 1988, WHO states that the main agenda this year is to highlight the growing inequalities in the access to essential HIV services around the world. It further states that the division, disparity, and disregard for human rights are among the failures that allow HIV to become and remain a global health crisis. This year, WHO and AIDS organization are calling on global leaders and citizens to rally to confront these inequalities that drive AIDS and reach people who are currently not receiving essentially the HIV services.
And exactly, in addition to that, what we really need to kind of talk about over here is that just very recently there was this news, ladies and gentlemen, that there's been an alarming increase in the disease of HIV. So imagine that we might be going somewhere wrong. We really need to educate our future generations. We really need to make sure that at least we keep our country HIV safe. Imagine a country where we cannot even get rid from polio. God forbid if such a menace strikes us, ladies and gentlemen, that's going to be really disturbing for our future generation, especially when we know that we have a major chunk of the population where people are very young. So we really need to consider early marriages and we really need to kind of educate them about protection too as well. So now, ladies and gentlemen, coming down towards what I love the most, and that's cricket. England team is touring Pakistan for 3-match test series. The first test match is underway. There were a lot of speculation whether the England team will be well enough to be able to play. But yes, alhamdulillah, England won the toss. They chose to bat, obviously, because on the 5th day, when it's going to be. And he made sure that he's going to go on a rickshaw to make sure to support his team. Wonderful Kristen Turner, ever since he has touched down in Pakistan, has been creating waves by being so creative. Thank you very much, Kristen, for the support you have showed towards your team by going on our rickshaw.
T20 series का दिलचस्प मुकाबला रहा और T20 वर्ल्ड कप फाइनल भी यादगार था. दोनों बार इंग्लैंड क्रिकेटर्स बाजी लगे. अब सबकी नजरें हैं टेस्ट पर. कौन सी टीम है बेस्ट? पहली से 21 दिसंबर तक जीत उसी की होगी जो गरम जोशी देखेगा. लड़कों, जम के खेलना क्योंकि है जज्बा, जुनून तो हिम्मत नहार.
Christian, কোথায় জ্বলছো?
राजा जी, पिंडी जोसा मैच तक सा. चलो चलें.
भाईजान तुसा मैच तक सो ते तुसा इंशाल्लाह हारसो भी. अच्छा जज्बा ਤੁਹਾਡਾ, ਅਸਾਂ ਤੁਹਾਡੀ ਤਾਰੀਫ ਕਰਨੇ ਆ. लेकिन इंशाल्लाह जिद्दां तुसी T20 वर्ल्ड कप दा अंदिया दिता सानू ए दोबारा नहीं होण लगा. On our home soil, home ground, ladies and gentlemen, obviously you will our team will make sure that they're going to win because they have a fair chance of making it to the World Test Championship final in 2023, which is set to take place in Oval.
Wonderful. So I think the
also Pindi, Raja ji?
I am from the Pindi. I categorize myself as a Pindi.
So I am from Pindi.
Yes.
Okay.
So I think it's wonderful that Christian Turner is getting so much enmeshed in Pakistani culture, and especially the truck card on that rickshaw was very enticing. So Shahzad, I felt in the recent years that Pakistan has been trying to invest a lot in its identity and the way it is invested in the Pakistani pavilion in Dubai. That was a very brilliant effort by Pakistan, and also there's a lot of literature scholarship coming on Pakistan which depicts the true culture of true arts, and which should be always there, but it was tainted by the terrorism or the extremism lens. So without any further ado, and we would like to discuss more on Pakistani culture because there's also Lok Mela going on there in Islamabad. So we are very lucky that we have been joined by Mr. Shahzad Durrani, and he happens to be the Joint Secretary at the Ministry of National Heritage and Cultural Division, and also simultaneously he is the Executive Director of Lok Virsa. So, Assalamu alaikum, sir, and thank you so much for coming to our show.
Walaikum salam. Thank you for having me.
It's wonderful to have you over here. First of all, obviously, when we speak about our arts and culture and people who look after the art and culture, they especially hold a very valuable place in our hearts. So, first of all, thank you very much for taking such a responsibility, which is not easier over here in Pakistan. But sir, congratulations! As soon as you took office, you were given this responsibility of the Lok Mela Festival.
Yes, I was.
I've been there twice, recorded it myself, shared it with our audiences in 47 different countries. So what I know, I'm going to share, and then we'll come back to you.
Sure.
So from all the provinces, the regional, provincial, each sort of representation, ladies and gentlemen, is at the Lok Virsa Festival. All you need to do is go there, check their cuisines, check their culinary arts, make sure that you check their handicrafts. You can get the Peshawari chappals, you can get the Balochi chadre, and for whatever
and
you
the
need.
charpais
And the best part is that it's not even expensive. These are the things which should be branded, and that's how we are branding it in Pakistan. But let's move on to Shahzad Bhai, because Shahzad Bhai, whoever's name is Shahzad, I've seen they're smart people around. And to be very honest, you know, when you took to office, all of a sudden you had this responsibility that you had to do it, and the benchmark was somewhere here. So was it difficult for you in the first place?
Yeah, it was difficult because it was the first time that I was heading such an institution, such a big responsibility. But I was lucky that I was trusted by my bosses, by our advisor to Prime Minister, Mr. Engineer Amir Mukam, and our secretary, Madam Farida Mazhar. They have been wonderful, they have been supportive, and they have always been there for us. So when I was given this responsibility, I was also given the power, the authority to make it happen. And the first thing that always needs to be addressed are the finances. So I was so I was given a budget which was given the financial constraints that we are facing currently was not as much as last year's, but still we have made do with that. And Alhamdulillah, response that we have received from the people, not only of Islamabad and Pindi, but from all across Pakistan and even foreigners, is amazing. So we're
And
lucky.
I mean,
The weather is perfect.
Weather
You
is
go out
perfect.
there, it's sunny over here in Islamabad. You enjoy the Mela.
Right.
Then there are culture nights followed by the entire day's Mela as well. And you know, there are people coming in, different languages. They have their own dances, which they, you know, you certainly do not even have to ask them that, you know, would you mind performing for us? Once you go there, you have this feeling of festivity,
And-
Mela, and it's going on.
And matter of the fact is, Shahzad, that I think in Pakistan we do not have a lot of areas or the what do you call the spaces there we could go out for the entertainment. The hoteling is the major source of that, but such sort of
You
festivals.
don't do that quite a lot, right?
I do that. Where did you get this impression
Why
from?
don't you take us then?
It wasn't my turn. I think next time it's your turn.
All
Okay.
right, sure.
Okay. So I wanted to ask you, sir, about the branding thing of Pakistan, and I do, like I mentioned in the earlier on, the Pakistan wants to brand itself as one of the oldest civilization, right? We are the predecessor of the Indus Valley civilization, and many of its major cities, Mohenjo-daro, Harappa, are inside the Pakistan. How does that equate with the Lok Virsa Mela thing?
Yeah, at the Lok Mela, what we are trying to do is project Pakistan's living culture. The culture is ancient. It starts not from Mohenjo-daro or Harappa, it starts from Mehergarh civilization.
True.
And from there on, we have still have the same traditions, same handicrafts, same patterns in our lives.
True.
We carry those traditions in our daily lives without knowing it.
True.
And what we are trying to do is bring artisans and artists from all over Pakistan together at one place to display that culture, to display that color, the colors of life that combine to make this beautiful rainbow that we call Pakistan.
Exactly, and it's beautiful. But sir, I think what is really pertinent to discuss over here is that, you know, all of these artisans given a chance once a year is something which might not be very sufficient. And you know, they obviously need their own outlets where they can display, people can go and do that. So how do you think that the government can actually play a pivotal role in making sure that they bridge that gap for all of those artisans where we think that unfortunately it might be dying?
Yeah, you are absolutely right. These artisans and artists, they need outlets. They need to reach people. Their products need to be seen and bought, purchased. So, as far as Lok Virsa is concerned, we have some small shops which we give out to
Right outside
these,
the museum.
yeah, outside the museum, and we have given these to these artisans, and they make their crafts sitting there all year round, not only during the Lok Mela. And those arts and crafts, they are on display all year round. Anyone can go there and buy these. But still, it's not enough. We need to do a lot more, and I'm sure that all our governments, especially the provincial governments, would be doing their part, because, as we all know, after the 18th Amendment, culture as a subject has been devolved to the provinces. So they are the major partners in this, and they have to do a lot
Exactly,
to.
and sir, this is something which we have seen while growing up. You know, all of these Sakafti melas, and we still remember our parents taking us there as well. Now, when we talk about, since you've spoken about 18th Amendment, that's something which I wanted to talk about even, and that's my interest because I've seen Lok Virsa, making sure that every single year they're going to have this festival and people come out in huge numbers.
Exactly.
Why can't we bridge that gap, which is a missing element because of the 18th Amendment, and kind of have partnerships or joint ventures with provincial governments to take them throughout all over Pakistan, so that Sindhi people can go to Gilgit-Baltistan, people from Punjab can go to Sindh.
Exactly. That is a brilliant idea. In fact, this year we have been discussing these things with our provincial counterparts during the Mela. This Mela provides us the opportunity to have interaction with our provincial counterparts in an informal setting. So we have been doing some thinking about it, and we have requested. Last night I was with the provincial minister for culture and tourism of Gilgit-Baltistan, and he was very keen on exactly this idea.
Yeah.
And we have decided that we'll sit together after the end of Mela and we'll do something about it. And on similar lines, I would like to do this. If the provinces invite us, we can coordinate and we can certainly go there and make
Or if the
this
ministry
happen.
can support you and can be in conversation with the
Yeah,
ministries and
obviously,
the provinces.
obviously, it all will be done through the ministry, and we would be keen to do that.
Exactly. In addition to that, sir, obviously, Alhamdulillah, you're a family man yourself. What have you enjoyed at the Mela by far? What sort of cuisines have you enjoyed every single day? Because being the executive director, obviously, they might bring it in. Sir, a tikka try karo. Sir, a balochi saji try karo.
Yeah.
So what have you tried?
Yeah, I have tried almost all the cuisine there, and
Can you name a few, please?
yeah, the ones that I liked the most.
Ji.
So I loved the saji,
Wow.
the ladi saji in the Balochistan pavilion, and then the KP chapal kebabs.
Wow.
Wonderful. And
I even overheard you in the office. Somebody, you were telling somebody about the chappal kebab,
yeah,
right?
I was, and also the Sindhi mawa.
Wow.
I tasted it for the first time and I loved it.
What is it?
It's a sweet dish.
Okay.
It's made from milk and that sort of khoya sort of thing, but quite
Suji,
different.
yeah,
Because when
not
we talk
suji.
about Sindh and Mawa, there's something very different which comes to our, come to our mind.
No.
Oh, yeah. Aa ja rahe.
No, not that one. And I also love the kava there in the KP Pavilion again.
I think after so many foods, you
Chappal
definitely
kebab,
need to
yaar.
have the kawa.
Yeah, you do,
for
you
the
do.
digestion purposes.
And more than food, looking at me, you might not guess it, but more than food, I love the dances and the music.
Wonderful.
Amazing dances and
And that too
songs and
with their
music.
provincial instruments.
Yeah, exactly. With the original instruments,
Yes.
the genuine thing. It's not that synthesized sound coming from the
computer?
keyboard or computer.
Or
So it's all
technology,
it's all original,
Organic.
authentic, organic. Exactly.
Wonderful, and I am really glad that we have such sort of representation here in Islamabad where we can enjoy different cultures. So, sir, this Mela is happening every year, right?
Yes.
So, what is different this time? How has that evolved over the years?
Yeah, it's been happening since 1981.
Oh, wonderful.
So it's been more than 40 years now. It's become a tradition of Islamabad, and we grew up going to these melas in our childhood, and this year it's the first time after the two pandemic years, the two COVID years,
Right.
that the lost years I would call them as far as cultural activity Islamabad is concerned. In those 2 years, the Mela did happen, but it was at a very limited stage. So because of all the restrictions and social distancing and that sort of thing. This year it is happening on a full scale for 10 days and with full participation of all the provinces and all the regions. And they have brought their authentic goods, artists, artisans, food, and it's fun. And once you go there, the thing that strikes you the most is the happiness, is the smiles on the
way the
faces of
people are
people.
enjoying,
Yeah,
yes.
they are enjoying themselves. They let loose and they just go. They enjoy the immersive experience that they have there. that brings a lot of joy to me,
And
being able to
certainly
do that.
Pakistan has a very celebratory culture, because we were talking also about it, that we celebrate everything, especially about the tappas, because my parents used to tell us that whenever they were sowing the plants, especially in the villages, they used to sing the song, and especially when they were plucking it out, they also used to sing the song to celebrate that. And this is the diversity of Pakistan. This is how Pakistan is, and we really enjoy and own our country.
So I think I'm going to take advantage of this opportunity, and I would rather request you to kind of share a tappa with us too, because there's one I remember. Chitta kukkad bane rete,
Kasni dupatte
Yeah,
wali
I think it is always
munda
worked. But sir,
sabhi.
very quickly, towards the end of this segment, obviously we've spoken about an array of what is available for our amazing people out there, so the people of Twin Cities can go. In fact, people from outside the cities even come to see the Mela. Not just that, because they are so interested in buying all of those things which are available over there, which are hand knitted, handmade, the original handicrafts, the organic handicrafts of Pakistan, and that too from all the different provinces and regions. So very quickly towards the end, so we have a cultural night too as well, right? So what happens on a cultural night?
Yeah, we have cultural nights of all the regions and provinces.
Every day?
Every night, yeah.
Wow.
So it starts from 6 and goes on till the audience
Is there.
is there. And we have a provincial night each night. So last night we have GB night,
Yes.
GB cultural night. Tonight we'll have Kashmir night.
Wow.
And tomorrow it will be Mehran night, then KP,
Wonderful.
And the finale?
then finale would be the Punjab night.
Finale will
on
be the
Sunday.
Punjab night. So ladies and gentlemen, the Lok Mela Festival is actually taking place till the 4th of December at Lok Virsa over here in Islamabad. Please make sure to go there. So do we have a ticket, and what price is the ticket?
Yeah, ticket is very nominal. We haven't increased the ticket for the last many years. It's 100 rupees for
That's it.
adults and 50 rupees for kids. Kids under 5 years, they go free.
Wow.
And no other ticket.
All my kids are under 5s, so I think I'm going to go too as well. But thank you very much, Azad
You're
bhai, for
welcome.
being with us. It was
You're
lovely
welcome.
to be in conversation with you, and it's a milestone that you've achieved. And that too right at the very beginning of when you've taken up the office as
Thank
well.
you,
So
thank you.
congratulations to you for the successful conduction of the Lok Mela Festival. Ladies and gentlemen, the humble request will be, please make sure that you go out there. I'm not going to say that go out there and support them. I think this is who we are. We really need to be out there for our people, for our talent, for our artisans, for our artists. Please make sure that you do that. But with that, we actually need to head out towards a short break, because when we are going to come back, now this is this very important subject, and that is that most of the time parents will tell you, "Beta doctor ban jao." When I was venturing into television, that's what I heard as well, and I was like, let me do what I want to do. But for people who really want to be doctors, if there's inner calling, how do they get themselves admitted? How do they choose which college to go to, which college will benefit them? Is something which we will be discussing, and then the health sector in general. Don't go anywhere. We'll be right back. Good morning.
back, and before going on to the break, we were talking about Pakistan's culture and cultural heritage and whatnot.
And
So-
even in the break, we were talking about Pakistan's culture.
True, that's true. And now we're going to talk about something which is very much important, and it's a universal access to healthcare policies and healthcare services in Pakistan. And also today happens to be World AIDS Day too,
Yes.
Shahzad. So this is a very pressing issue, and we need to talk about it and popularize this concept that talking about it should not be stigmatized at all, right?
True.
We need to have more such of conversations, because with the emergence of social media, I mean, there's so much access to information already out there. So I think it's a high time that we need to guide our children, youth about it, and how to tackle such sort of issue. So without any further ado, we would like to introduce our guest, who happens to be Mr. Yasir Khan Niazi. He happens to be Managing Director, Islamabad Medical and Dental College, and also of the Dr. Akbar Niazi Teaching Hospital. Assalamu alaikum, sir, and thank you so much for coming to our show.
Thank you for inviting me over.
So it's always an honor to have you over here. You certainly in the Twin Cities and over here in Pakistan happen to be one of the most influential figures, alhamdulillah.
Thank you.
You've been producing a lot more
Alhamdulillah.
educated future generations. You've taken that responsibility and you've been really true to that. So thank you very much for your service to the nation.
Thank you
It's
very
an honor to have you over here. Let's get started. First things first, obviously it happens to be World AIDS Day. Very recently, we have seen this very depressing news. In fact, it was disturbing that there has been an alarming increase in HIV, and that too over here in Islamabad and Rawalpindi as well. First of all, what's your take on that? How do you think that we need to educate our future generations, where Pakistan happens to be one of those countries where 60% or more population is of youngsters?
Yes, it's very important. Thank you very much for picking this topic today and talking about it. I think this is a topic which we need to talk about. It's a taboo.
True.
We, in our culture, in our society, it's not something we want to talk about. It's not easy to talk about.
True.
It's not easy to talk about with our youth about it. There's a taboo and cultural barriers which stops us. We need to overcome that because it's a reality.
True.
And if we don't talk about it, this has a potential to become an epidemic levels. And it is. It's showing the numbers right now. The increase which is showing right now are alarming.
Exactly.
And we have to create awareness, and we have to talk to our youth about it and about their lifestyle. As we become more westernized and adopt a westernized lifestyle, this becomes a big issue for us. And it's not only because of the lifestyle, it's blood transfusion and other things. And it's very currently the issue. Another issue is very low reported. It's not reported to a level which it is. People don't get tested.
True.
The thing is, it's a stigma, but it's not something bad. HIV is curable now.
True.
If it's there are a prevention to it, there is management program for it. So if we find out or if we test about it, there is nothing to be afraid of. It's nothing that we used to have a stigma of that it goes through the touch, feeling and all this. It's not of any that sort. We just have to have the awareness, use the precaution, and we have to create awareness among our youth about this epidemic, and we need to overcome it.
And it is of utmost importance as well. And sir, right at the beginning, I've mentioned that Pakistan happens to be one of those countries where polio still exists. So imagine, God forbid, if we have another catastrophe in the name of HIV, that certainly will have a lot of burden on our medic facilities as well.
Exactly, and the thing is, it's not necessary. It's increasing because of the lifestyle. It's the reuse of
Blades and going
blades,
to the barbers.
barbers, things like that. So there are many other reasons. If you have one infected person, it can spread in other ways. Not necessary. It means that there are social ills in the society, and we have to be realistic about it. And the people who have HIV, we need to embrace them into the society. We need to help them out. We need to counsel them. We need to encourage them. And we need to make them productive members of the society. So this awareness can be increased and we could have this under control.
And sir, in times of COVID, we have seen that there was so much testing going on. I mean, it's just not the blades of the, going to the barber. I think it can be the reuse of the syringes too. Exactly. And imagine that, people like us, we were blessed that, we were able to afford those tests from some expensive and quality standard laboratories. But imagine people in the rural areas. What do you think they might have done? And that might, God forbid, be the reason post-COVID that we are seeing an alarming increase, and that too in HIV.
The thing is, the program exists. The government have a HIV program,
Right,
and
so
they
they have an
are
eye.
providing the support. It's only the matter is awareness. Even awareness among the healthcare workers to know where to send the patient if they suspect to get them tested. The hospitals have to take responsibility and test the patients.
And how do you do that?
Well, you have to identify the high risk population, and then you go and test them whenever you get a chance. The government is providing us with all kind of the facilities. I wouldn't blame the government here.
Yeah.
Unfortunately, for us, it's very easy escape for us to say, and
We don't
the
do it at all.
facilities are.
Yeah.
Yeah. But the thing is, facilities are here. The healthcare sector has to step up. The education sector has to step up and help with awareness, and we have to start with the vigilance, first of all, when it comes to blood transfusions, when it comes to reuse of blades and barbers where we have a blood exchange happening, as well as at some stage the lifestyle.
Exactly.
And also, Shahzad, we've seen that there are a lot of conversation regarding the One Health, where the health of the humans, health of the animals, and health of the environment is all intertwined. So, for example, just imagine the COVID was because we have put so much strain on the Earth's resources that we've seen that the pandemic was out there and infected the entire globe out there, right?
Well, there can be a different opinion, whether it was from a lab in China or not.
I mean, these are conspiracy
yeah.
theories. We don't know what is the truth out there, but a lot of scientific journals pointed out that the transmission was from the bats. But until there's authentic research out there, we really don't know.
Nobody's going to let that
speculating
research
it.
come out. Now, that's what the problem is. I think everybody needs to be very honest with them. Imagine,
Right.
so all of these controversies we've been talking about, we never know. It might be the pharmaceutical companies who wanted to bring in their medicine, for the cure of COVID, so you never know. It can be either way around. But let's not go over there since we were talking about awareness over here.
Right.
So, sir, obviously it's that season where a lot of children are looking forward to getting admissions into medical colleges. And you happen to be one of the leading medical colleges over here, and that too you have an entire education segment which you are catering to, may it be dentistry, may it be MBBS, so mashallah. And it has taken you years to build that facility, and I've been a witness to that because my nephew became a dentist from your dental college. I'm DC. Now, what I wanted to talk about over here is that what will you suggest for the kids out there? What range of marks are you considering over here? How many applications, first of all, do you have?
Well, medical education remains the most popular form of education the students seek in Pakistan. It's very popular. There's a lot of demand. There's a lot of interest, and people still see hospitals and they see hospitals and being a doctor a very honorable profession. So there's a lot of interest from them. And that's what it creates that we currently, just to give you an example, that we have 100 seats in MBBS.
That's it.
And, that's it. But we have 11,000 applications. That's 1,000 students per seat.
True.
And that's the type of competition we are looking at. What my message to the first of the students, if you don't get admission in medical college, that's not end of the world.
True.
Medical profession is vast, and there are so many other specialties you can do in medical education and do that and progress and contribute. The COVID showed us that how much we need the virology, immunology, research, development of diseases, vaccine, and these kind of researches.
Research, yes.
These are all what we need. And we need to look into these type of specialties. Nutrition, we are talking about AIDS prevention, the community medicine, the prevention side of the medicine also. It's a big, vast field. But those who are seeking, what I will tell them, do your diligence. Know where you're applying. Just getting into a medical college is not enough.
True.
Know where you're applying.
So tell us
where
today,
we
sir.
are.
Well, that's why we have you over here.
Exactly. You know what I recommend to them, go and do some due diligence on the college. Look at the faculty. Look at and most importantly, look at their teaching hospital. What is their teaching hospital? Because the thing is, the practical training happens at the hospital. So the quality of the teaching hospital matters when you are choosing a medical college, especially in private sector. Government sectors, we are very much blessed with very good hospitals, but in private sector, there are still needs choice to be made. Then you need to look at the faculty. Then you also look at the extracurricular activities being offered. in terms of career development, leadership development, because this is a relationship you're going to be forming with an institution for next 5 to 6 years. And this is what is going to determine where you are and where you're going to go in the future.
So how
chooses wisely.
So it is obviously a challenge for the education sector as well when we speak about medicine. How do you think now you're going to make sure that when the competition is so tough that there are 1,000 candidates for one seat? What are you looking forward to? What sort of kids would you want in your college?
Sorry. What we look for is we look for a student who can take, who has the leadership, who has shown leadership qualities. We prefer a well-rounded student who will come in, who can take the pressure. Because the medical education is changing. It's becoming more evidence-based. It's becoming more problem-based rather than theoretical as it used to be.
Yes.
So you have to have some, other than that, you have a very good books knowledge and how you can learn from the books. You have to start learning practically. We have integrated models. There's no more subjects anymore. There is system-based education which is coming up. Then we have clerkship model, which is more that you will get involved with the patient and learning from the patient from the very beginning. So the medical education is evolving and it's developing and it's innovating. Technology is coming in. So you have to have, when we select the students, the selection of the students is very important, that we look at that the student which has the acumen to understand these things and most of all take pressure.
Exactly. And sir, very quickly, when we speak about taking pressure, obviously there might be a lot of pressure on you, because when we speak about a private medical college, I think we speak about 11,000 applications. That means 11,000 people have, alhamdulillah, wealthy parents, who are still looking forward to their kids getting admission. Whether they get into a government college, that's not their concern. They're like, beta, doctor bano bas. So how do you handle the pressure? Do people call you most of the time, कि sir ये देखें please मेरे बच्चे का दाखला? Pakistan का culture है थोड़ा सा.
Yes, it is.
So how do you handle that?
Very good question, and very hard to answer. We manage.
Yeah.
We look at it from case to case basis. Sometimes we look at, because at least at Islamabad Medical and Dental College, financial is not. We look for the students. And if we find a good student, it doesn't matter if he can afford or not. We have a scholarship program, we have a sport program, we do that. Plus, then we like to develop a diversity also. We are blessed that everybody from Pakistan applies there. So we want to create an environment, student body, which is representative of Pakistan. And we do give consideration to the different areas so the different cultures can come together and we learn from it. Islamabad Medical and Dental College students is a community, and it's a community of scholars, and we want to keep it. We don't want to make it that it's only Islamabad, Rawalpindi students or from this area. We make a concerted effort that we get diversity in, and where we not only learn from each other, but we learn from each other's languages, cultures, because Pakistan is blessed. We have such a beautiful language and cultures, and as we move more than 50 kilometers, we have a new culture which is introduced, and we want to bring that beauty of diversity to our
So there's no
student
compromise on quality.
There's never.
Wonderful.
Wonderful. So talking about the universal access to the healthcare, right? How can we universalize this concept of free access to healthcare? Because obviously in the rural areas, there are a lot of people who are suffering from the healthcare problems and they do not have access to that. So how can we do that?
And before you answer that, I bear witness to it because I've been to IMDC myself. So imagine that people actually think that dentistry is really very expensive.
Okay.
So they've always made sure that it's not going to be expensive. It's
Wonderful.
affordable for a lot of people. Imagine that I've even taken my domestic staff over there.
Wonderful.
They were very helpful, and all of the doctors who were there, they treat you with state-of-the-art facility, everything, they're equipped with everything, and their rates are nominal. So, if you're actually looking for cheaper dentistry solutions, I mean, for where you really need help, it's not aesthetic, I think IMDC is the place to go. Please.
Yes. Universal healthcare is important. This is a basic right.
True.
We have what I call a revolutionary program and Sehat Sulat program it is. And I think it should continue. And private sector and public sector needs to work in to make sure that it works. It's a start. There's always problem with any program which is introduced. There's always challenges there. Eventually, we will have to move to insurance-based healthcare industry. At the same time, healthcare industry in the private sector has to understand that it's an industry. It needs to operate that way. So we need to look at it from a point of view that, we need to develop economies of scale, introduce technologies. And through technology, we need to access and provide healthcare to the rural areas where it is. Because Pakistan has a unique problem. We have shortage of our healthcare workers. And I'm not talking about doctors here only. We have challenges with our nursing care, which is actually the patient care. We have our technologists. We have a big issue with the medical technology and having the right technologists at the right places.
On top of that.
Exactly. So we need to develop that. So we need to declare a healthcare emergency going forward, because now we are increasing. We are already beyond 220 million. We're already talking about 230 million people. And this problem, and with the bulge of youth and the problems and the disease and environmental impact on health is coming up. If we do not declare a health emergency and come up with a comprehensive health policy plan, I think Pakistan is looking at a huge challenge in the future.
So, sir, where do you think that that the government and the private stakeholders actually join hands? Do you think that has happened previously and that's the way forward in future?
It hasn't. Unfortunately, we always looked at them very separately. Public and healthcare system. Private has always been demonized in one way or another, and it's and things like that. The government has to realize that in order to provide universal healthcare, private sector is a partner. And they need to view private sector as their partner and see how we can. The government's job is to provide regulatory and standardization and qualities. Healthcare management is better done and more efficiently in private sector. So the private sector has to step up. Yes, it is. It has to be a mix. You can't have one and another. Because what COVID has proved us has shown us one thing, that at one end we have the NHS model, which is the nationalized healthcare. That was under strain. On the other hand, we have 100% private sector, which is the American system, we call it, the most commercialized system. Both of them at some stage failed and did not deliver. So we have to keep on trying to find the equilibrium where public-private sector has to reach, and everybody needs to know what their roles are. You can't leave it. I agree with that. We can't leave it 100% to the corporate sector, and we can't. But the thing is, the efficiency in the public sector is not there.
Thank you very much, Yasir.
And adding to this conversation, thank you so much for saying that. And the reason you mentioned the NHS failed and also the commercialized system failed was because they never valued human. They've always valued the capital over that, and that is why. But I'm very glad that Pakistan has always pioneered the massive social welfare schemes. So, for example, Benazir Income Support Program was there, and was given access to the women, especially the women of the rural areas, where they can access the medical services. And I'm really glad and proud that we have such sort of models here.
Exactly. And in addition to that, ladies and gentlemen, obviously Sehat Card was an initiative of Mia Mohammed Nawaz Sharif Saab as well. So it just got renamed. But thank you very much, Yasir Bhai, for being with us. Thank you very much for counseling our future generations. Till the next time, ladies and gentlemen, look after yourselves. We'll see you tomorrow morning. Good morning. Allah Hafiz.